Oraqix with Dr. Karen Gangocha, BDS, M. Clindent, Implantology, London, Principal Dentist. Dr. Gangocha is an award-winning dental surgeon and key opinion leader for Dentsply Sirona CAD/CAM. She qualified from the University of Guy's and St Thomas's Dental Institute in the United Kingdom. She is the founder and owner of Smile Essence, fully private practice in East Moseley, United Kingdom.
Oraqix is an amide local anaesthetic indicated for adults who require localised anaesthesia in periodontal pockets during scaling and root planing. Clinicians can use the included blunt-tipped applicator instead of a needle and a dispenser to apply the gel to the gingival margins and the periodontal pockets. It may be reapplied as needed to the maximum recommended dosage. Benefits include: it is needle-free, which is less invasive for the patient. It has a neutral pH, making it safe to use on inflamed tissues, easy pre-measured cartridge, and it's the only FDA-approved anaesthetic for scaling and root planing. I would use Oraqix if patients are apprehensive or if I want to avoid injectable anaesthetics. And lastly, if I have a patient with any contraindications to injectable anaesthetics. Break the seal and remove the plastic cover from the sharp-tipped end of the applicator. Attach blunt-tipped applicator. The air bubble present in the Oraqix cartridge allows the user to determine if the product is in liquid or gel form. The blunt-tipped end of the applicator may be bent to improve access to the periodontal pockets using the cap. If a greater bend than 45 degrees is desired, a double bend technique is recommended. Insert Oraqix cartridge pulling back on the handle. Push cartridge forward, engaging the sharp-tipped end. Apply pressure to the handle, engaging the piston. Dispense Oraqix by depressing the handle. The volume of Oraqix used per tooth is independent of the periodontal pocket space. Consult the Oraqix product information for specific dose information. Oraqix is a viscous liquid. Dispensing slowly and evenly works best. Apply Oraqix on the gingival margin around the selected teeth using the blunt-tipped applicator. Wait 30 seconds and then fill the periodontal pockets with Oraqix using the blunt-tipped applicator until the gel becomes visible at the gingival margin. Wait another 30 seconds before starting treatment. A longer waiting time does not enhance the anaesthesia. Anesthetic effect, as assessed by probing the pocket depths, has a duration of approximately 20 minutes. 1 cartridge or less of Oraqix will be sufficient for 1 quadrant of the dentition. When the cartridge is nearly empty, the rubber plunger will be visible in the transparent section of the dispenser tip. Recap the blunt-tipped applicator. Although the tip is blunt, use a Jenker or a one-handed technique to prevent accidental exposure to the contaminated cannula. Remove the empty cartridge by pulling back on the handle, sliding the cartridge from the applicator, and then remove the cartridge from the syringe. Dispose of in the same manner as a contaminated dental injection needle. After cleaning, disinfect and/or sterilize according to the current infection control procedures and directions. In closing, we would like to reinforce the topics discussed in this non-injectable anaesthesia video. Oraqix has many benefits shown and discussed in this video, such as administration with a blunt tip, neutral pH, and ease of use for apprehensive patients. Our goal is to provide high-quality dentistry in a pain-free environment. Before using any of the drugs or devices discussed or pictured in this program, clinicians should consult the full prescribing information. Only licensed or certified dental professionals are permitted to administer non-injectable local anesthesia. Administration of Oraqix and animations depicted in this video were simulated for educational purposes only.